Rib fracture suffered by the candidate for mayor of São Paulo, Pablo Marçal, in São Paulo, Brazil. Here, Daniel Coriolano. I am a doctor, and from now on we will address this news focusing on the health aspects related to the injury suffered by Pablo Marçal and the possible consequences of a trauma of this nature. Summary of the assault and injuries. According to news reports in the main media outlets, Pablo Marçal was hit by a chair, resulting in a fractured rib, specifically in the 6th costal arch. He also had injuries to his hand, which led to the need for examinations at the Syrio-Libanese hospital. Having reviewed the news, we will now detail the potential bodily damage that can occur after a trauma of this type, of this nature, in addition to prognoses and possible treatments. The anatomy involved. First, let's talk about the rib. The rib cage is made up of 12 pairs of ribs that protect vital organs, such as the lungs and the heart. The 6th rib is located in the lower part of the rib cage and, when fractured, can cause intense pain, making breathing and torso movements difficult. In the first few moments, the pain can be suppressed by the moment of emotion, but after that initial minute after the trauma, it will undoubtedly become so uncomfortable that it prevents any activity. The hand, made up of bones, muscles, and tendons, is even more susceptible to injuries due to direct impact, such as with a chair. But so, what would be the possible immediate damages? In the short term, consider that direct trauma can cause at least 3 problems. Rib fracture. A fracture in the 6th rib causes sharp, intense pain, especially when breathing deeply, coughing, or moving. Depending on the severity, a rib fracture can become complicated, leading to injuries to adjacent organs, such as the lungs. This could result in a more serious situation, such as a pneumothorax, which is an accumulation of air in the pleural cavity, or pulmonary contusion. But of course, in intense situations. I did not have access to examine Marçal or even see the exams, but here we deal with possibilities. Let's continue. A second problem that can occur after a rib and hand injury is bruises and muscle injuries. The thoracic region also has intercostal muscles, and the force of the impact can cause bruises and muscle strains, resulting in pain and limited movement both in the short term and in the medium term, that is, after weeks. And about hand injuries. The aggression may have caused injuries to the bones of the hand, metacarpals, or to the tendons, which would explain the difficulty in mobility that Marçal reported in one of his fingers. A fracture or tendon rupture would require immobilization, or even surgical intervention. Another question that arises is, can the damage occur in the medium to long term? I would like to point out that we are dealing with estimates here, without having access to the patient. Therefore, if there are no immediate complications, the rib fracture is expected to heal in around 4 to 6 weeks. During this period, it is common to feel pain when breathing, coughing, or moving. There are 3 possible scenarios. 1. No sequelae. With adequate rest and avoiding physical exertion, the fracture can heal completely, and Marçal can return to his normal activities in a few weeks. 2. Possible complications. If the fracture is confirmed and/or is complex, or has caused damage to the surrounding tissues, such as the lung, a pneumothorax or hemothorax may form, which I think is unlikely to happen, since he has already recorded a video and was able to communicate. However, if this complication were to occur, it would require more intensive treatment, including drainage during hospitalization. 3. Chronic pain. In some cases, even after healing, that is, even after 4 to 6 weeks, the person may continue to feel pain in the fracture area due to injuries to the intercostal nerves. This scenario may require medical monitoring, and in some cases, physical therapy, or use of painkillers for prolonged periods. And now, let's talk about possible prognoses and recommendations. Here, I also estimated 3 scenarios. Optimistic scenario. The rib fracture heals without complications, and hand mobility is recovered with rest and adequate treatment. Marçal could return to his full activities in a few weeks. Intermediate scenario. If there is any complication, such as pneumothorax or hemothorax, a longer recovery time and additional treatments may be necessary. Scenario with complications. In the case of chronic pain in the rib region or mobility problems in the hand, Marçal may need prolonged medical monitoring and specific interventions, such as physiotherapy and the use of medications and interventions of greater power and complexity to control the pain. I would like to emphasize that the video is not politically biased, and the objective here is to clarify the possible health damages resulting from this type of aggression. Traumas like these require immediate medical attention and monitoring, since the injuries can vary in severity and complexity. Similar traumas happen every day and reach emergency medical services, whether due to aggression from one person against another, domestic accidents, or car accidents. Is there anything else you would like to know that I didn't mention? Leave your comment here. Remember to like the video and subscribe to the channel. If you want to know more, click on the video that is playing on the screen. Daniel Coriolano here. A big hug, and see you next time.